I must say a warm welcome to everyone who've taken a little bit of time out this evening to spend with us. It's a topic, Amanda, that's of great interest. I think the big buzzword is immediacy and immediate implant treatment and immediate loading and so on. So following on from Anthony, who informed me this morning that he was my warm-up act, that I will follow him and talk a little bit about a sort of a surgical perspective and maybe some technical aspects to this as well. I'll also focus a little bit on single tooth replacements, because that's principally where most of my interest lies with immediate implants, although I will share a case towards the end of a full arch situation. But yeah, the focus will be on single tooth implants, immediate implants, and immediate loading. Okay, so there we go. So if we think about the history of osseointegration, well, it's pretty much over 50 years now that we've had, you know, the development of the scientific basis and the clinical advances, as well as the material advances for osseointegration. So 50 years, it's a long history. I came into it a little later than that in 1982. I'm trying to think now. Sorry, 1992 when I first placed my first implant. So that was almost 30 years ago today. But if we think back, the first 25 years of the so-called modern era of implant dentistry was where the indications were predominantly those fully edentulous patients, where the implants were placed into healed sites. So if teeth were present, the patients were rendered edentulous. A period of time was allowed for healing to take place. And then when the implants were placed, there was an extended non-loading period before the prosthesis was connected to the implant.